Hey everyone, welcome back to my channel. If you're new here, welcome as well. So it's been 6 months since my heart transplant, and I want to do an update. It's been a long journey, ups and downs, lots of bumps, but I am getting there. Progressing. I'm doing okay physically. I'm getting my strength back, and it's a lot. I'm not trying to make this video too long. All right, so there was a previous video that talked about the first and second heart offers that I received where the transplant was not successful due to different reasons. It's in the health. I'm not going to go over there. I don't think I mentioned or even spoke about that I received a third heart offer. So I had February 11th, March 3rd, and then April 9th was the third offer. And the reason why that transplant did not go through was because the person didn't pass away within the time frame that would make the organs okay to be transplanted into someone else. So something along that term. I'm not a doctor or anything, I don't remember, but it was explained to me, and it didn't happen. Another depressing hospital visit, going home. So I got the call on Mother's Day. I was home. It was the day after my daughter's competition. We were in New Jersey, and Kate made the day before. We had a lovely time. And on Mother's Day, I got the call, and the coordinator's phone number came up, and I was kind of shocked because I'm like, first of all, it's Mother's Day, and I'm like, I was waiting for it because the first 3 times it was within the first half of the month. I'm like, it seems like every month now I'm getting an offer. So it didn't I didn't answer the phone. She called again, she texted me, and I was like so nervous. I spoke to my husband, spoke to my sister, said I was gonna take it, and then I spoke to the coordinator, and then I told her that after I didn't want the offer. She was like, why? And I was like, I don't know, I just made up some weird excuse, and I did not want to take it because I was just scared. And I was also like, the whole mental thing that I went through the past 3 times and it didn't happen, it's really like still affected me. So, but I knew that one of them was going to stick. I knew that one of them was going to be it. And I think deep down inside I felt like this was going to be it. So she had me speak to the doctor. She was like, if you have any questions or concerns, if I can help, like, would you like to speak to a doctor maybe? So I spoke with the doctor, the head of the transplant team, for a little while with my sister, my husband, and he answered a couple questions. I was concerned, like, the person's age, I honestly don't remember. I've been through so much, I really don't remember, but I didn't want it. I eventually said yes, and I packed my bags. I didn't pack anything. I put things aside. I think I had things set aside because it's happened so many times before. Got ready to go. Lingered a lot because I had to fix my daughter's hair. Like, in the midst of getting ready to go to the hospital to get a heart transplant, I'm here fixing some of her braids because her hair needed to be done at the time, and it was just the timing. It was supposed to be done that week. So I was fixing some of the braids. I'm like, make it a little bit doable, and they kept calling me at the hospital. I'm like, I'm coming. But I was like, I just need to make sure my baby girl was okay for at least a week or so, until like one of my one of my friends could take her to the salon to get her hair done. So went to the hospital, all went well, surgery went well, transplant went well. Recovery in the hospital was, while I started walking around, I did a lot of journaling, and I painted, I colored, I played Uno. My husband came and visited every day. The kids came at the later part. I didn't want them to see me in the ICU with everything all hooked up. I had them come once some of the tubes were taken out, and I was a little bit more Not that I'm shielding anything from them, but I just didn't want them there at that time. It's also, I have to process everything that's happening at the same time. So they didn't come at that time. They came later on, but I got to see them a few days. They came to see me. My daughter came. She walked with me. It was so nice. My husband came towards the end. You know, we would eat dinner as a family in the hospital, and I had a really nice view. I was right across from Central Park. The sunsets were amazing. I look forward to that every day. When it was raining, I love the rain so much. So I managed the first 2 weeks in the hospital, and then I went home. So I went home on May 30th, which was a Thursday. Friday, I received a phone call from the visiting nurse service because they're supposed to come and visit you within 24 hours or 48 hours after you are discharged from a hospital if you had surgery. So when I spoke to the visiting nurse, I guess the coordinator to set up the appointment, it was a Friday. Um, and she was like, we're gonna send someone tomorrow, Saturday. And I'm like, oh, I just didn't want to see anybody out. I was just like, I was just overwhelmed. I'm like, can they come on Sunday? I just needed the day. She's like, okay, fine, I'll come on Sunday. So Sunday came around. In the morning, I woke up, I checked my blood pressure. My blood pressure was super high. I'm usually pretty low, but I don't know, for some reason it was so high. And after that, the visiting nurse, the nurse came. It was a man, and we were going over like the paperwork and everything that, a brief history. I told him my blood pressure was high and I was gonna call my transplant team, to let them know, because I don't know what to do. Is it meds? Is it something? Should I need to go to the hospital? Whatever, because it was really high. So he was like, okay, we're gonna look into that. So he took my blood pressure and it was high as well. I was eating peanut butter and apples because that's one of the things I could tolerate at the time. So I was eating after he checked my blood pressure because he's writing down some things and then he was going to like make some calls. Then all of a sudden, like, I felt like I couldn't breathe. Like, I felt it was very hard to breathe. Like, I felt like the oxygen and the air was just sucked out of my body. It's a weird thing, but that's exactly how I felt. Like, I was trying to take a deep breath, but it was like no air. Air wasn't going in where it was supposed to go. It was just really scary. I told him, I said, I feel like I can't breathe. It's hard to breathe. It's hard to breathe. And in the same moment, I felt like my brain was swelling in my head. And you can't tell me anything otherwise. I said my brain was swelling in my head, and it was later confirmed that it's exactly the experience that I had, and that's what happened. So it was Sunday. I had that episode, and I woke up in the hospital in the ICU on Tuesday. And I woke up and I saw my husband's face, and he's like, Siobhan, do you know where you are? And then he was just smiling at me, which made me feel a little better because I woke up freaking out because obviously I did not walk into the hospital. How did I get here? What happened? Like, what day is it? The nurses were there, the doctors were there, and when I tell you, it was one of the most scariest experiences that I've ever experienced. And it kind of haunts me even to today because my ring light just died and I have to fix it because the light is not that great. Because it's just one of those things that you didn't go to the hospital and you wake up there and you're like, you lost time. You don't know what happened to you. They said I was having like seizure-like symptoms and everything. So initially when I woke up, I think she said they thought I had a stroke or whatever because I was like zoned out in the house apparently. So the nurse had walked me over to the chair. This is from what my husband and my mom told me. The nurse walked me over to the living room, to the couch. They sat me down and I was just there, like gazing just like this. And I don't know what happened. But they took me to a local hospital, which was close by. And they sedated me there because they didn't have the ability to treat me there. I was a recent transplant patient. I had to go to the hospital in the city. And I was sedated, and then I was in the ambulance from Long Island to New York City, back to the hospital. My husband, I think he was in the ambulance with me. So in the I don't know. At some point, I got sedated, and then I woke up the Tuesday in the hospital in the ICU. So I later found out that I developed a condition called PRES, PRES, which is like the abbreviation for posterior something something syndrome. It's it was caused by the immunosuppressant medication that I was on, which was called Prograf, and Prograf is a medication that is given to pretty much 95% of transplant patients. So when they did my labs and everything, they saw that I had like a really high amount of it in my blood, which was like 16 or something like that, and the goal was like 5 or 6, and it was like they did the MRIs, they saw the swelling in my head, which when I explained to my doctor what I was experiencing, she said exactly, this is exactly what it is. It's press. They ruled out that I didn't have a stroke, which I was so happy for. They still kept me on seizure medication because I was having seizure-like symptoms, so anything neurological. So I was on those meds for literally like 3 months. But it was just the scariest time, and it was so scary. So they had to switch my medications, and they switched it to one called cyclosporin, where it's an old medication that's usually used to treat patients who've had kidney transplants. But I'm taking that in addition to Belataset infusion monthly, and also everolimus, which is a cancer drug. It's a chemo drug. So those are the three combination I take as my immunosuppressant cocktail, I could say. So I was in the hospital for 2 weeks. My husband came every day. I look forward to seeing him every day. I think the day after me waking up, I didn't sleep for 24 hours, almost 48 hours. I was up. I was so wired. I couldn't sleep. I basically was up. Every time I closed my eyes, I saw the scariest images and visions, and it was just really scary. I was scared to close my eyes, and even if I closed my eyes and I tried to sleep, I couldn't sleep. It was just such a scary thing. I think it was the meds. Like, I would close my eyes, and I was scared to close my eyes because of what I saw when I closed my eyes. It was like scary images and just weird, out of this world things. My vision got messed up from the meds. They ended up giving me eye drops. I mean, it corrected itself over time, but it was just one of those things. So being in there for 2 weeks, 2 more weeks, I pleaded to everyone that I needed to be home for my kids. I needed to be home to watch them graduate. My daughter was graduating from middle school, son was graduating from high school, and my daughter had a dance. I just wanted to be there. I needed to be there for them. It was just like, I think if I was not given that opportunity to be there for them, that would have really, 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 really hurt. So I went to my son's. I got out, I think a day or two before, and I made all of those events, which I'm grateful for. And I shared that on Instagram, and I shared that on uh, TikTok. So back at home, physically recovering, doing cardiac rehab. I do twice a week, Tuesdays and Thursdays. You do various machines to work on just being active again. In addition to that, I started walking. I do my daily walks. I'm up to like 3.5 miles on one walk if I can do that. It's been cold, so I kind of haven't been walking this week because I'm trying to figure out like how am I going to dress now. I'm just like nervous with the cold. Ever since my surgery, I'm always cold. I know that my body has really regulated its ability to regulate its temperature. Like, I'll be really cold, and then I'll be hot where I have to like take layers off. It's just no in between. But next week I'm back on my walk, so I figured out what I'm gonna wear. I did some research and I bought some stuff. And I am journaling, keeping my mind um, I wouldn't say I don't always keep myself busy, but I have things and tools in place to help me to keep myself busy. So, I went to the doctor at the end of July for my normal routine checkup, and I had an echocardiogram where they saw that my heart function had dropped to 25%. It was 55 prior. So they kept me over in the hospital. My doctor said she couldn't let me go home because this is signs of rejection. So I was in the hospital for about 3 or 4 days, and I was given a cocktail of medications to help, um, stop my body from fighting off the organ, the new heart. And another setback, like, I know things don't always have to be perfect. It doesn't always have to be perfect, and it's not always going to be perfect, but the little setbacks that I've had, little and big, being woken up in the ICU and also just having this episode of rejection, it really, really did affect me mentally. It affected me, and it's probably part of the reason why I feel like I'm struggling so much now mentally. It's just everything that I've been through. I'll be 40 at the end of next month, and this was the first year I actually planned. I wanted to do something for my birthday, like a party or something, but I don't know. I mean, just being here and being alive is enough for me. So I just never really wanted a party, but I don't know if I want to be around that many people to have something right now. But 40 next year, and I've been fighting heart disease since I was 19. So it's about 20 years of my life, and I'm tired. I'm tired. I'm tired. And but I have to keep fighting. I keep telling myself that I didn't come this far just to come this far. It is a real struggle mentally, and I can see how people, when they're going through rough times medically or whatever, how they can fall into depression and it can consume them, and they can fall into these deep places, the deep and dark places. If you're not strong enough, you will fall into those dark spaces. And luckily for me, I don't know if it's because of my will and the fight in me, I immediately sought out help when I started thinking in ways that I've never thought before. Like, I don't want to do this anymore. I don't want to take my meds. This is not me. Like, why am I thinking like that? All right, I need this address. This is not the type of person I am. So it's a mental battle. You have to fight back on the thoughts and everything, and it's a daily battle. I get up every day. I feel sick from the meds. I'm nauseous. My stomach hurts. The physical changes that I'm experiencing, the medications have so many side effects. One of the medications that I'm taking has like abnormal hair growth, and one of the medications, you can't really see it now, but my skin has gotten a lot of hyperpigmentation because my concealer, my foundation is now my concealer. That's just how much of a difference. My lips, they got swollen, and they're so thin, and they like are so sensitive that they hurt if I like don't keep them like super moist. And I don't know if you can tell, but this hand is swollen, and this my joints hurt. So physically, I can walk up the stairs without feeling tired. I can walk 3 miles. I can do the things that I couldn't do before easily, which is the point, and I'm grateful for that. Mentally, I am in a space right now where I need to just talk to someone about my feelings and talk to them to figure out, not to figure out, but to help me cope, because I'm struggling. It's a struggle. And another thing that I struggle with now is, and I realized it this week, someone asked me, like, do I feel like my heart? Do I know it's there, but I don't acknowledge it. It's like I try not to think about it because I'm so scared. I feel like I, I'm like living in fear right now. And even though my labs are good, I'm doing good, my doctors are reassuring me, but I have to get this out of my head. I have to move past this. I have to process this because of everything that has happened in the past. It's like I'm scared. Like if I feel an extra beat or something, I'm like, oh my God, why was that happening? And is it something? Is it rejection? Is it like, it's scary. It's scary just thinking that I have to take these pills every single day for the rest of my life. If I don't take these pills, my body will start to attack the heart. It will go into rejection, and then that's it. It's scary knowing that. It's scary knowing that I don't know. This heart is new, and it may sound weird, but I think about my old heart all the time. I don't know if I feel like a part of me is gone. Maybe that's why I don't acknowledge the heart. But at a sense, I'm very grateful for it. I'm very grateful for it. But this is why I'm having therapy. So, medical trauma is real. I've discovered that, and I feel like I have PTSD. And you just have to do what you have to do to take care of yourself. This road, this journey is not easy. I don't know what anything could have really prepared me, but it's a mental fight, fighting every day. Um, I do my best to keep myself entertained. I journal. I have things to keep me and to do things. I sleep when I can. If my back is comfortable, I'm gonna take a nap. That's me. I'm gonna nap. I'm always gonna nap. The mood changes. I'm super emotional. I I'm just always, I don't know. I want to get to a place where I look back on this video like 6 months from now and just say, wow, come a long way. And even from the beginning to now, 6 months, I have come a long way. And I'm excited to see what the next 6 months offer. But I'm also scared. But I don't even think that far ahead. I'm just taking it one day at a time because I find that it helps to just deal with the day instead of trying to deal with the future. It's less stress, and I sorry, I need to my lip again. They feel like they're hurting. So, and they get dry easily. But it is a process. It is a journey. And I am doing well. Someone asked about the donor. I don't know the donor or their family. I do know that the protocol is after a year, you're able to write a letter to the family and then they can decide if they want to respond. So we'll see when that time comes. I can't say whether or not I want to do that in a year. If you were to ask me that now, if I had the opportunity to do that now, I would not. I'm not in the right mental space for that right now because one thing I think about in addition to everything that's on my mind is like every time I celebrate like the 13th when my transplant took place, I think that that's the date their person passed away. And you ever like want to be happy but you can't really be too happy. That's just how I feel. And I know that's common because I ask about this in this transplant support group on Facebook. So a lot of the times I'll post a question just to see if it's just me or if it's just a normal thing, just to kind of see if like, am I going to get through this? Am I going to pass this? But it's really been hard mentally. Healing physically, I would say, has been easy, but healing mentally is the hardest part. And with everything that I've been through, it's really it's really hard. But I have to do what I have to do because I'm not gonna say like, oh, I have to do what I have to do because I have a family and everything, but I also have to do what I have to do for myself because I want to be here. I want to live life. There's a lot of things that I want to do, and also for my family, obviously. But I never really did a lot prior because I was, restricted so much. I was sick. I mean, now I have a different set of restrictions, but I can live life, do it a little bit more. I'm a little stronger, and I am getting stronger as the days go by, as I do more. I have diet restrictions that I have to abide by. Nothing undercooked. Everything has to be fully cooked. No eating food sitting out for more than 2 hours. No salad bars, no buffets, and things like that, which those are not an issue for me. My husband is very good with the food safety protocols. That was like his thing prior, so that was nothing really changed in that. And it's a lifestyle adjustment. I wear my mask when I go out because I'm just scared of getting sick because I'm now immunocompromised. I get overwhelmed easily if I'm out with anyone. It's like, okay, I'm ready to go home. I've had enough. My mental capacity to handle certain things is just not it. And I listen to my body, and I don't make excuses anymore. Like if I'm with someone and I just want to go home, I want to go home, all right, and I don't have to explain it. But on the outside, I I look fine. I feel good internally, mentally is what I'm working on right now. And it's been rough, but I haven't come this far just to come this far. And I will continue to keep going and doing my best. And I'm looking forward to the next 6 months to see how things have changed. I'm trying to put the fear at bay because it's like always there. But that's the little update I have. I don't know if I covered everything. I probably missed so many things because I want to talk about certain things and then I don't want to talk about it because I'm gonna cry, and I'm not gonna cry on video. But heart transplant update, 6 months, and that's it. Thank you so much for watching, and if you have any questions, just leave them in the comments, and if I remember something that I wanted to say, I'll put it in the description. But thank you for watching. I really appreciate the love and support that I've received from everyone over the past 6 months.